Hey folks, I just wanted to make a wee quick video here just about the level of treatment that people have to tolerate in Scotland from GP practices and hospitals and stuff like that, but hospitals not so much, just mostly GP practices, right? Here's the thing, whenever I get a repeat prescription or whenever I go to the GP practice or whatever, there always seems to be mistakes made, you know, like I get 6 items on a repeat prescription from the GP practice on a regular basis, and there's always items missing, even though I had the GP practice manager set up the quantities of medication, so as I just go in once a month and just say, okay, I need this, and they just give it to me, right? But there's always mistakes made, and I'm back and forth all the time to try and get these fixed. So really, I'm quite within my rights to make a complaint. I make a complaint about it. I've made numerous complaints about the fact that they keep missing medication all the time. And just recently, I made a complaint about them referring me to a department in the hospital for treatment for something, and then they phone me up and tell me actually that was the wrong department and I need another doctor's appointment for them to do the proper referral. When I had said to them, look, just do it, you know, like you don't need another appointment, just get the doctor to do the right referral to the right department. But then when I was in speaking to the doctor, I went in the appointment anyway, so I went in and spoke to the doctor and I said, look, you know, what's going on here, you know, because obviously, like, I need this treatment, you know. And he was like, well, we thought, and I've got it recorded, I record everything. And he was like, oh, well, we thought that was the right department, you know, like we, as far as we are aware, that is the right department. And he says, well, what can I do about this? He says, well, they don't have a means to treat that condition, so it will go untreated, you know, maybe raise it with psychiatry or something like that, you know. So I was a bit upset about that, you know. I like a bit upset about the fact that they either got the wrong department, which they're maintaining they didn't get the wrong department, even though the receptionist told me that, and the doctor says that he thought it was the right department, you know. So the communication between me and the doctors and GPs and whatnot, you know, there doesn't really seem to be getting the right information. But nonetheless, I made a complaint about it, and I'm quite within my rights to make a complaint about it. And as I've made a complaint about it, they've removed me from their list, their GP, the general practitioner's list, at Fallin Medical Practice. So Fallin Medical Practice have removed me from their list because I made a complaint about ongoing mistakes, and then them telling me that they thought that was the right department, but it wasn't. You know what I mean? Because they don't treat that condition, and then them telling me that, oh, well, it turns out that there's no treatment in the Scottish NHS for that condition. You know, so there's a very grey area happening here as to whether or not they actually have the right to remove me, and I don't think they do, because patients have a right to complain. And I have ADHD. Everybody knows I have ADHD. I've got it on my YouTube and everything. But I think one of the things that they've done is they've not taken into account my ability to articulate myself effectively, like and understand what's being said back, like 100%, and they've just removed me. They've just removed me from their list. Now they can't just remove you. That's not how it really works. Apparently, it has to go to what's this place? This place is General, Practitioner Services, PSD Medical. So it has to go to PSD Medical for them to remove me. Now I've emailed PSD Medical to say, look, I don't think they have grounds to remove me from their list, because I live in a country town, you know, there's no other GP practice here. I'd have to go out of town to get a GP practice, and that makes it more difficult for me. What I think has happened is they don't like the tone that I've taken with them when I've emailed them. That's what I get, you know, because they are saying that they think there's been a breakdown in patient-doctor relations, so they just removed me, you know. And I've emailed them and said to them, look, I don't think you're right, you know, like they think that I have lost confidence in their abilities to do their job. And yeah, they keep making mistakes, but I'm not really bothered that much about them making mistakes as long as they fix them. And they have in the past. They've sent letters of apology saying, sorry, that won't happen again, and then it happens again, and then then I write another complaint, and then it's and then it happens again and again, you know. So yeah, it is a bit of an issue, but just tick all the boxes for my medication and send it. You know, it's not actually that difficult. And each time they get it wrong, they go into this long-winded explanation about acute medications and non-acute medications, and I'm like, listen, I don't care what the procedure is, just get the procedure right, you know. But nonetheless, they've decided to try and remove me from the GP practice, which I'm not going to allow them to do, because I'm not going to bother my arse going out of town to some other town to get a GP practice. No, I'm not doing that. So I've emailed this practitioner services, and I've emailed the public service ombudsman, and according to the public service ombudsman, they don't actually have grounds to remove me, so they're probably going to overturn it anyway. And in their letter, when they were telling me why they're going to remove me, they said they don't have the time to keep responding to my complaints when I make a complaint about medication being missing, or when I make a complaint about something, you know, like whatever it may be. You know, like I had a possible case of Lyme disease, and I was phoning up the practice to try and get an appointment, and they refused me an appointment based on the fact that they don't deal with that, and I had to go to accident emergency. But then when I spoke to accident emergency, it says no, your GP is your first port of call for that incident. So there was a bit of back and forth there. So I made a complaint to the NHS Scotland, and I made a complaint to the GP practice, because I had a possible case of Lyme disease, and luckily turned out not to be. But nobody was willing to give me an appointment to get this checked. So naturally you had to complain. So yeah, there's been a few complaints going in back and forth and whatnot, but that's my right as a patient to complain. You know, you can't just say, oh, you can't complain because it's taken up too much of our time to respond to you. That doesn't fly with me, that, you know. And then them saying, oh, I've mentioned in one of my emails about mistake after mistake after mistake, like that terminology. You know, if you stop making mistakes, then I won't use that terminology. You know, and even at that, that's not even really that bad of terminology. You know, like I could be really abusive, I could be shouting at them, I could be giving them abuse, but I don't. I record all of my doctor's appointments. I record all of the phone calls back and forth between them, and I've let my girlfriend listen to those phone calls and those appointments, and she's a nurse, and she says, no, you're perfectly fine, you're talking to them normally, you know. And I'm not a hostile person, so I wouldn't outright be hostile with anybody. But yeah, this is their means of trying to make my life difficult, because I keep complaining about them missing medication from my medication list, and more recently them not doing a referral correctly to the right department, or not giving me the right information about there not being a department to deal with that. You know, like they should have just said that right at the start, and then there would have been no issue. So yeah, and another thing that I think they don't like is the tone that I take with them in the emails. So obviously doctors don't like being told, you know, like, obviously, no, I don't think that's correct, or I don't think that's right, or, you know, like, I think you need to do this, or you think you need to do that, or could you prescribe this, or could prescribe that. They don't like to be told. You know what I mean? They're very strong-willed that way, you know. But if I know within myself that, okay, I've got an infection here, or I've got this, or I've got that, and I need antibiotics, you know, like, I don't want to have to wait 2 weeks for a blood test to get my infection marker list in to tell me that I've got an infection, to give me the antibiotics. I'd rather you just give me the antibiotics to get rid of it. And they did when I was forthright with them, you know. But they don't like that kind of personality. They don't like that kind of person to be forthright with them, you know. Like, I know my own body, I know what's going on, and I know if something's wrong. And, you know, honestly, I think the tone that I've taken with them in my complaints and whatnot, you know, where I've been blatant and blunt, I don't think they like it. You know, like, I've not been abusive, I've not been aggressive or anything like that. I've just been straight up with them, you know, like, no messing about. And I think that's more of the reason why they've removed me. and this is a joke. People are exposed to this on a regular basis, and I don't think it's right. You know, like, how many people have been in this same situation that I'm in now, and not really knowing how to fight through it, and just let it happen, and now they're the inconvenience of having to go to a different town for a GP practice. I don't agree with that at all. You know, like, this Fallin Medical practice, that, like, they are making mistakes on a regular basis. And I think I'd posted a thing on Facebook asking about this. You know, has anybody else encountered any problems with the GP practice? Most people were positive about it, but there was a couple of comments that highlighted issues with incompetence within the staff. And I thought, maybe there's actually more to this than what I'm experiencing, because other people are clearly experiencing similar things with missing medications and whatnot. Even the pharmacy, I think, are actually sick and tired of the doctors doing this kind of thing, because it gives them more work when the receptionists and the doctors or whatever, when they mess up on their prescriptions, it gives the pharmacy more work to write out to do all these prescriptions all the time. You know, so I think they're pretty sick of them as well, because every time a prescription comes in and I question it and I go, oh, you know, where's this item, and they go, oh, and you can see like they're, oh, that's not been sent over, you know, you need to go and speak to the GP. And I'm like, okay, no problems. And I go and speak to the GP because I know it's not the pharmacy's fault. You know what I mean? But you can see the tiresome attitude from the pharmacy when it comes to Fallin Medical practice and their incompetence, basically, you know. And that's kind of how I put it in the emails. I'd go, like, there's a level of incompetence here that is exponential, and doing something simple like prescribing a medication really shouldn't be so difficult. I've never encountered it before. I've been here for, I don't know, maybe about 2 years or something like that, and I've never encountered these problems in another practice before. You know, they've always just prescribed the medication, you know, like, without any sort of hitch. You know, just sent it over to the pharmacy, and then I just go and collect it. And there's never really been an issue, but there seems to be some kind of issue here, and I don't really know what it is, but I reserve the right to complain. And if I don't complain, how am I meant to get the most effective treatment? You know? And as a result of me complaining, they have then removed me from the practice. So we'll see what happens. But I think people, you know, if there's others in the country, in Scotland, you know, that have encountered issues like this, I think maybe, you know, leave a wee comment or something like that in this post, and then I can see what's going on, you know, because I think this is more of an epidemic than what it seems. You know, people being removed from a patient list because they make a complaint doesn't seem like right, that does it? Doesn't seem right at all. When a complaint is made, yeah, it might hurt their ego, you know what I mean, but, you know, when you're prescribing, when you're providing treatment for somebody, your ego shouldn't really enter into whether or not you've got it right or you've got it wrong. Just do what is required of you to, you know, as a GP or as a receptionist or as a practice manager. Just do the right thing. But hey, I'll let you all know how I get on. But yeah, have a good day.